stress. We know there's a lot of folks right now who are trapped in homes. Their kids are trapped in the same homes. They're used to being with their kids, but not all the time. And certainly this has created a lot of challenging conversations, we know, for a lot of parents and for the kids themselves. And how is it that families can develop some competency around dealing with all that stress when everybody's sort of packed in together?
Yes. So, thank you, Sam. So, the stress, especially right now related to the virus, is something that each individual is going to respond to differently. But everybody has a reaction to it. So in terms of the family situation, when a parent comes home to the family and is concerned about some of the issues that Sam indicated, concern about a job, concern about paying the bills, etc., that extends to the children, and it extends to the partner. And so where the person needs to start first is with themselves. Okay, so how does a person deal with that stress? Well, we know there are certain things that will be helpful, and one is called mindfulness. What's mindfulness? Simply put, is in the present moment. That's all it means. So how do I get in the present moment when my concern is about the future? The way I get in the present moment is to anchor myself with my senses. So I notice, what am I looking at? What am I listening to? What am I touching? What am I hearing? What am I smelling? Okay? Where does that take me? It takes me right here. And with that, then, I am able to step back from all of the stimulation of the anxiety that I have been subjected to from this virus. So now, why is that important for the family? Because the children are watching the parents. Children learn through modeling. And in this virus situation, there's an enormous opportunity for parents to help their children to develop competencies in the face of uncertainty. But the way they do that is by seeing the parents model that. So let's take an example where a parent is going to lose a job or may lose a job. For them to come home, gather the family members that are old enough and talk to them about, look, this is what might happen. And if it does, this is how we will respond to it. So it's informing the children, it's including them, and it's also indicating we've got this. That's an important lesson for them, and it builds bonds within the family. The other thing that the parent can do is to ask the children, in the face of this, what do you think are the responsibilities that we're going to have to take care of? And which of those responsibilities would you want to contribute to and help? So those are some of the ways that a family can work through a difficult situation and grow, develop competencies, and really create, in the face of all this distancing, some emotional connection.
Mm-hmm. Thank you.
Mm-hmm.
And Dr. Tyson, I'm going to tell you what, I'll take the top of the microphone. We're going to vow to wash our hands, both of us, after this this passing of the microphone to ensure we are doing our best not to do, to certainly to follow the mandates of our county. But, how is it that as we think about all the information that people are deluged with on the internet, on television, we know there's a lot of anxiety and fear that simply is created by the incredible outpouring of bad news. And how is it that people can, in some way or another, modulate what information they take in? How is the best way for folks to be able to take in information at a time when we know it's a lot of bad news out there? We know people need to be informed. It's important for people to be informed. But at the same time, we also know that if all that stress is just resulting in a lot of counterproductive behavior, it needs in some way or another to be modulated. How do people grapple with all that?
Okay.
We are using wipes, I'll assure you.
Okay. So first thing, let's look at the anxiety that's created from all of that, quote, bad news. Why is that created? Well, it's created because at some level, I don't believe that I have the competencies to handle that anxiety or those events. And so the first step is really to break down what is that information telling me, okay? So it's telling me sometimes contradictory information. It's telling me bad news. It's telling me that, yes, people are working on a cure, but we don't have one, et cetera, et cetera. So now in that uncertainty, how do I ground myself? Well, I ground myself in competency. What's that? Well, it's taking the actions that I can take that actually relieve the anxiety because it's putting it within a realm that I can manage it. So we have information not so much on the virus and when it's going to have a vaccine, etc., but we have information on how to protect ourselves from that virus. So we can have social distancing, we can have, Purell wipes and, etc. We can basically as well limit our exposure to that kind of information, which undermines a sense of being able to be in the present. So as I'm in the present, I can take actions that support my well-being. Good immune system choices, good eating choices, sleep. And the other thing is limiting my exposure to that by maybe once a day with a resource that I trust, that is well known for or best known for good data. Okay? So the other thing is not to spend time in social circumstances where we continue to relive all the fears, but rather to direct the conversations with our friends and families to solutions. What is it that you're doing that's helpful here? And what is it, this is what I'm doing. So it can be, someone was telling me they had a quarantine party and nobody was invited. All right. And another example is, for the first time ever, this person got to read a book that they wanted to read. They spend time with their children in positive activity. They cultivate sometimes with this time off, a hobby that they've kind of had right out of line of sight, but now there's some time to actually spend some time with it. So it's looking at this in terms of it's not just what we exclude from view, but it's what we take in that cultivates our own well-being. Mm-hmm. And some people haven't even reflected on that in their lives for a long time. And so here's an opportunity to actually do that. Okay. And I'm sure your listeners have other ideas that are that they could think about as well.
Yes, absolutely. And yes, we will. We promise to wash our hands after using this mic. And I do want to encourage folks who do have ideas about how they're coping through this challenging time and how their family is. If you have great ideas that you'd like to share, with other folks in the Facebook community, please just type those in, and we'll make sure that others can see those as well. It's been a time, we know, for a lot of folks of a lot of isolation and loneliness. And we're already a community in Silicon Valley of overworked people who probably do not connect enough. And perhaps our only social connection often was through work, or maybe perhaps whatever limited opportunities we might have had outside of work. And now those are all cut off, whether it was at church or anywhere else. Now, obviously, a lot of folks are grappling with depression and loneliness already. Time like this, it's got to be even more challenging. What are your recommendations to folks who are struggling through those issues?
Okay. So let me just step back for a second and say that some people don't struggle with loneliness. Not everyone does. There are some people who louder. So there are some people who appreciate the time alone and this time off, and they're not a large number of them, but it's just to acknowledge that that is the case. For people who find this, who live alone and who find this situation one of felt loneliness, some of the ways in which to look at that, and I encourage people that I talk to look at that, because I've noticed sometimes loneliness involves a loneliness for ourselves. To come to know ourselves in ways that we have not taken the time, the effort, the perspective to do. And that needs to be cultivated for all of us, whether we're living alone or living in a relationship. Because in my experience with people who at least come through my office, there can be a lot of loneliness in partnering and a lot of loneliness in marriages. And so it's just to recognize that it's not to pathologize it, I guess is what I'm saying. And it's to experience it as an invitation to go deeper within ourselves. So that's one way. That said, a person who lives alone and does experience some loneliness and this desire to reach out to others, I really encourage them to do that, even if it's uncomfortable for them. Because in this event, one of the opportunities in this event is to stretch ourselves, to extend beyond our comfort zone into an arena that we might not otherwise consider doing. And so sometimes people will say, well, that person never calls me. Okay. And what can you do at this point? So it's what action can I take? I want to talk to this person, so I will call them, even though they haven't called me recently. And the other thing is to reach out in terms of somebody in the community that you don't really know, a resource that you can support in the community. Join some kind of a group of people that are actually espousing and supporting something that you really care about deeply, so that there's meaningful experience for you when you participate. Yeah.
And that's actually a perfect segue for me to give a pitch, self-serving pitch here. SiliconValleyStrong.org is a website that everyone can get onto to both get and give help. And since you mentioned there are ways for folks to connect, particularly if you're feeling a little isolated, been home an awful lot lately, and you really like to get out, you can still volunteer. And yes, that is as the county has determined, that is an essential activity when you're volunteering for great nonprofits like Second Harvest Food Bank that are helping to provide food for a lot of folks. So please go on SiliconValleyStrong.org and you can sign up and volunteer there, give money. You can also learn about what's going on throughout the Valley as we're all grappling with this challenge, and we'll be posting a lot of information in the coming days to see how we can pull together through this tough time. So we know that lots of challenges that have been with us are now highlighted and exacerbated in various ways. One of those is addiction, and that's something that so many of us grapple with, and it's in all of our families. And at a time when people really need to go to NA meetings or AA meetings, and they no longer have that connection to folks who can help, not able to get out in the same way, how do you recommend that people who've been grappling with addiction be able to forge on through this time when they're really required to really stay home?
Well, that's challenging. Fortunately, in many of these programs, there are people that they have as sponsors. And I believe those individuals would be available to people who are suffering with this kind of a pain. The other thing is that it's to encourage people near the person or around the person with the addiction to have compassion for what that person is experiencing, as well as for themselves, because it's really difficult for people to live with someone who has an addiction. But what I encourage is that if we can bring a sense of caring that this person is suffering and that we're suffering, and a sense of compassion for the suffering of lots of other people, it's what opens the heart. It's what allows us to be vulnerable in life. And if this virus hasn't taught us anything, it is certainly the truth about the fact that as human beings, we are vulnerable. And it's what do we do in the face of that vulnerability? So in a particular instance of addiction, I encourage people who care for individuals with these difficulties to engage them, not to isolate them, not to judge them, but to engage them, as hard as that might be. But in my experience in listening to people, that's what can help. It's what can help. It's that connection. Yeah.
Thank you, Mary. And I encourage everyone who has questions that they'd like to pose or suggestions for others in the community, please post them on the Facebook page, and we'd be happy. We're going to actually be assembling a lot of ideas over the next several days and weeks and sharing them with the community about how we can all keep each other well and keep ourselves well. And this is just a start. So as we think about wellness, we also know this is a time of very serious illness. And I know new numbers are coming out every day about the number of our neighbors that are afflicted with this. I just heard for the first time about someone we've lost who I actually knew. And for a lot of families, this is going to hit very close to home. And we know that for a lot of parents, they're going to have a difficult time explaining the loss of loved ones, of friends, because we know that this pandemic is going to take a lot of lives. What's your recommendation for parents who are, for the first time, trying to explain to a young child both the risks and the harm of serious illness as well as death?
Okay, thank you. So let's appreciate that this is probably the hardest part regarding the virus, and the most difficult for parents to handle in relationship to their children. So I have a few recommendations about that. and that is to be transparent in a wise way. So let's say Grandma gets the virus. So the parents together, hopefully, would gather the family, the children, and say, we want you to know that Grandma is sick and she has gone to the hospital where the doctors can help her. That's the best place for Grandma to be. And then you wait and you listen to see what the children's questions are. And they may have some questions about, well, how long will Grandma be there? Well, we really don't know. And what becomes really important is that the children see in the parents that this is part of life. It's an uncomfortable, it's a stressful part of life, but it is part of life. And again, this is about parents utilizing the situation to teach their children competencies and to model those competencies. So let's say that Grandma, unfortunately, dies. Let's say Grandma is 79 years old and Grandma dies. Now what? So the parents bring the children together again, and they decide in advance how they will present this to them. And that becomes really important because you want to tell them the truth. At the same time, you want to be able to reassure them about what distinguishes Grandma from them. Because children will then, without that clarification, can think, okay, well, when will Mom or Dad die? When will I die? So you want to clarify that. So you bring the children together again and say, tell them Grandma has died, and the reason is that Grandma was frail and her body didn't have the ability to respond to the treatments. And that in no way increases the chance of Mommy or Daddy dying. Okay? And that needs to be stated in a very assertive way, so that the children are not imagining what this means or why Grandma died and who's next. Okay? I will tell you the importance of this because some parents, with the best of intention, will sometimes not tell the children what's occurred until much later. I had a client not too long ago who, 45 years later is telling me in my office that she was never told about her grandmother dying for 3 months after it had occurred. And the parents didn't tell that about the grandma dying because they didn't want to traumatize her. Well, here she is 45 years later remembering that event. That's trauma.
Yeah.
Yeah. So.
Yeah, point well taken. And, as those conversations, inevitably go from worry to something much worse, in terms of how the parents hold themselves around the pain of losing loved ones or having loved ones who are threatened with this, I know there's a lot of different thinking about how much pain and grief can parents feel free to show here. I mean, given obviously the age of the child, do you have any recommendations for how parents steer through that emotionally in terms of what they show about their own feelings, whether it's anxiety or worry or grief?
Yeah. Thank you. So, appropriate to the level of the child, right? And authentic. So the parents need to collaborate in advance of messaging to the child what's happened to grandma, as an example. And so it's normal to feel sadness and grief. When a parent becomes intensely emotional. It's usually frightening to a small child because they perceive it as out of control. All right? The older the child, even that is threatening to the child. So it's letting the child know your feelings, and at the same time listening to the child's feelings is very, very important. And also asking the child, how can you express your feelings? In what way can you remember Grandma in a way so that the children begin to think about, well, we could plant a flower, or maybe we could or plant a tree to remember Grandma, because Grandma loved apples, so let's plant an apple tree. Or the children will come up with all kinds of ideas. And what's important about that, again, it's creating these family bonds through whatever occurs, through joy, through sadness. It's like for the child to realize, I'm safe here. There are people here at the helm that are taking care of the natural flow of life. And the virus is an unfortunate part of the vulnerability that we as human beings have. And that's a part of life too. So it's not trying to make everything, it's not sanitizing everything. It's not trying to make everything wonderful. It's not. It's helping this child see that this is how we can show up competently. This is how we can show up in the midst of a crisis. And I will say, parents sometimes worry about, having enough money to leave their kids, having enough of fill in the blank to leave their children. I will say to every parent, the greatest gift you can give your child is to model competency emotionally and otherwise in the face of difficulties. And this coronavirus is an enormous opportunity for doing that for your children. We'd never wish it. We'd never choose it. We'd never want it. But we've got it. And in the face of having it, we can utilize it to our children's benefit. Yeah.
So you mentioned opportunity, and I know much has been made. I think John Kennedy, who believed, I think he said, actually turned out to be not quite true, that the Chinese character for crisis included the word opportunity. Later that was debunked, but nonetheless it seemed like a good thing to say. There is opportunity in crisis. You described one context in which a parent's talking to a child and modeling how it is you're able to show up in a way through a very difficult time and still be able to demonstrate how we're going to continue to pull together and be able to and really model competency, as you said. So what other opportunities are there? Let's take it outside the parent-child relationship, just in terms of our own well-being. What other opportunities are there for us in this crisis where we are essentially homebound for the most part? A few of us are working in what we call in essential industries, according to the state of California, but whatever that means. So maybe some of us are working too. We know lots of folks are struggling because they don't have paychecks. That is certainly the biggest crisis for many. For others, it's a serious health issue. But what is the opportunity in this crisis for many of us?
I think one opportunity is the realization, the undeniable realization that we are all in this together. That no person is independent of this virus. And so that's a perspective that requires us to look beyond ourselves and just taking care of ourselves in order to look at this larger community, because if the larger community doesn't work, if the larger community isn't healthy, if the larger community doesn't support this stay in place, we're all at risk. And so, so that's one. The other thing is to recognize that there is a lot of pain that people are suffering in the midst of this virus, and it may not be obvious to some of the people who are not experiencing some of those difficulties. And so the opportunity here is that if you have resources, it's not that you should share them at all. It's simply to ask yourself, is there an inclination in me that I want to share them? And if I haven't done that in the past, if I do it, then to have the experience of what was that like for me? So I'm expanding, if you will, my social consciousness there. I'm helping someone in that process. I mean, think of the terror of not knowing how you're going to pay your bills. And there's a lot of people who feel that, or who feel, even with the restrictions on evictions, etc., that they have home insecurity. And so it's being able to empathize with that to the point of action. Again, not as a should, but simply as a noticing, will I join this community in a way that I'm actually contributing to it? And from an emotional standpoint, if I don't have discretionary resources to help somebody who needs financial help, well, what else can I do? Well, I might be able to connect them with resources that would help them, and they might not know about that. That's another way I can join the community, and what I can say to you is that in that kind of activity, there tends to be a sense of joy in people, which is supportive of our well-being. And it's certainly an antidote to the sense of anxiety and helplessness that we can fall into in the midst of this. You know, one of the things that I would encourage considering is that the degree of anxiety is really a function of my perception of the threat and my perception of my competencies to meet that threat. So if I'm engaged in taking action to mitigate that threat, I have then utilized a skill that has not only helped me, but it's also helped somebody else in that community. And, some people are doing this just in terms of uplifting their mental health, their sense of well-being, is they're having parties online, right? They're inviting people. They're including people. They'll walk and maintain social distance. So there's a lot of ways we can take care of ourselves and model for the community, this is something I can do as well. Yeah.
Thank you. Mm-hmm. And on that note, I do want to encourage, if you have any questions or any suggestions about what you're doing, what your family or friends might be doing to really encourage your wellness or those of members of our community, please share them. We'd love to hear your thoughts. Just type them in to the Facebook page, and also please your questions as well for Dr. Marianne Tyson. Again, we're here with Dr. Marianne Tyson to talk about our social and psychological wellness in this time of crisis and how we can best preserve ourselves and help others. And I should point out, just building on the point that Dr. Tyson just offered, that SiliconValleyStrong.org is an easy way for folks to plug in. Certainly, if you want to give resources, we would love to have the dollars. Those dollars go to the Silicon Valley Community Foundation Fund that is helping many struggling families be able to hold on through this tough time. We also are happy to have volunteers. More than 1,700 volunteers have signed up already. This site's only been up for a few days. It tells you something about the heart of our community, that we've got so many folks ready to step up, and they're volunteering at Second Harvest Food Bank and many other nonprofits that we're working with to help folks who are maybe not able to get out to get food, a lot of seniors, for example. And there's a lot of information there as well. Information for folks who are concerned, for example, about whether or not they might get evicted. Well, we do have an eviction moratorium in place here in San Jose and many other cities now as well. Governor Newsom just announced forbearance on mortgage foreclosures for 3 months. You can get more information about that online. Opportunities for small businesses to be able to get access to small business assistance loans. Then now Congress is expanding. So a lot of resources. We want to make sure we connect you to resources, and we want to also connect those of you who have resources, whether it's your time, energy, or treasure, to the need that we have in this valley, and we know that need is very great right now. Dr. Tyson, I really appreciate you joining us today. I really wanted to ask, for those who are maybe haven't had the experience of being able to benefit from counseling directly, maybe haven't had the resources, and how is it that you recommend that people think about their mental health of others in their family? If maybe this is an area where they're just not that familiar and not feeling very well versed, and there's a lot of sources of anxiety, fear, pain. What's a good first step? Are there books that you'd recommend, something online, anything that you think is a good first step for someone to start to think about how I can get help?
Yes, well, there's a book that I like very much, and it's actually a book written by a Buddhist nun, but you don't have to believe in Buddhism or anything else to appreciate it. It's called When Things Fall Apart, and my copy is pretty close to falling apart. So it's been well loved and well used, and it's been tremendously beneficial because it's written by Pema Chodron, and she's a woman who's very compassionate and friendly towards herself. She talks about that she goes around the world teaching meditation, and she says she's just the worst meditator in the world. And yet she has this wisdom about her, and she connects with the idea of that life involves vulnerability, disappointment, difficulties, etc. And that's all the material for our growth. So it's to invite that in. It's not to make it something that represents a mistake in our lives or represents something that we want to avoid, but actually the very material of our growing. And so the first step, if someone hasn't been interested in therapy, I think it's a book like that, and because it deals with the real difficulties that often bring people into therapy. So, from my point of view, my practice, my primary values have always been to put myself out of a job. I haven't managed to do that yet. I keep hoping to. But the values of my practice have been always efficiency and effectiveness, because I believe that people don't have a lot of money for therapy. So there are certain things that you can focus on that will really help you be resilient to the need for therapy. Mm-hmm. And so one of those things is to not over-pathologize yourself. I get clients in sometimes and they'll say, Dr. I'm depressed. Okay. So how long have you been depressed? Oh, about a week. And I'll say, well, what makes you think you're depressed? Well, yada, yada, yada. Well, that doesn't even make the clinical definition of depression, right? So it's that idea that if we come from a place of thinking, my life shouldn't have any sadness to it, it shouldn't have any disappointment to it, then we're going to think we're depressed when we're anxious or when we're disappointed. So it's to not over-pathologize. What meets the clinical definition when you really would benefit by consulting an effective therapist? And that is when there's an impairment with yourself, like in the case of an addiction, or in the case of you can't get out of bed because you're depressed, right? Or you're difficulty in an interpersonal relationship, or difficulty with work. So those are the three areas in which, if there's impairment in any one of those areas, it calls for talking to a therapist.
Mm-hmm. Thank you.
Uh-huh.
And I see Rachel would like to jump in with a question we have from our audience.
So one of our viewers asks, what about online resources we should be considering to help us cope, and young people who are worried about their older parents? What is something that they can do for that?
Let's go to Dr. Tyson with that second question. Let me just jump on and offer a few ready resources. By the way, I've read that book by Pema Chodron, When Things Fall Apart. It's a wonderful book. For those of you who have not read it, I strongly recommend it. It is great because, let's face it, in all of our lives, things fall apart, and it is helpful. There are some hotlines I want to make sure people are aware of if they need immediate help. And we know that resources are a real challenge right now for an awful lot of families. So first, with regard to substance abuse and mental health, we have a disaster distress helpline. That is 1-800-985-5990. And this recording will be on Facebook for some time, so you can certainly rewind it and get all these numbers if I don't get it to you right the first time. Again, 1-800-985-5990. The National Suicide Prevention Lifeline, if you or someone close to you is seriously considering suicide, 1-800-273-TALK. Again, 1-800-273-8255. And that's a free confidential crisis hotline. It's available 24/7. And also for veterans, we know there are a lot of challenges that veterans have, ADHD, or text to 838-255. And that's specifically for veterans. And that's also connects you to other veterans who are trained in responding. So let's go to that question that you had just asked, Rachel. If you could repeat it again, and we'll bring it right to Dr. Tyson.
Yeah, absolutely. What about young people who are worried about their parents? How can they cope? How can they help their parents?
Young people are worried about their parents. What do you think?
Okay, thanks. So that's lovely to begin with. You know, that young people are concerned about their older parents. It shows that there's a bond there and a caring there, and that's not evident in every family. Mm-hmm. So good for your listener for that. Mm-hmm. And so in terms of how the young person can cope, the first thing is to recognize what is it that they're worried about in terms of their parents. Okay, is it that they're in the high-risk group where they're at risk for serious illness? Is it that they're in the high-risk group and they're seeing possible decisions that could occur that would make it really risky for them if they even went out of their house? That's another level, okay? Is the concern that they're not eating properly and they need some support there? Okay, so this varies. If it's that they want to make sure that the parents are taking care of themselves, then they need to have a conversation with the parents in terms of expressing their caring for them and concern for them, and also what resources or what support do they need in order to take care of themselves properly. And then what would they be willing to have? What kind of support would they be willing to have from their child? Because this is all around respect, right? And it's very difficult sometimes because children, adult children, have an agenda sometimes about what they think the parents need. And just as the parents have had agendas about what they think the child needs, right? So it comes back to visit us again. And so it's an opportunity again for communication whereby there's respect for the other. Okay? And to work it out there. Okay.
And I should just add, if there is concern specifically with resources, access to food, I know for many seniors that is a real concern right now in our community. Please dial 211 or go on our website, SiliconValleyStrong.org, and you can get information there, and also provide us information about how to get to a senior who may need help with delivery of food. Dr. Tyson, this has been such a pleasure, and I really appreciate you taking the time to be here with us and to share your insights with the community. We know that there's a lot of pain right now that folks are grappling with. And I know that your words are certainly helpful, and I always consider you to be one of the wisest human beings I ever ran into. So I hope that others benefit from your wisdom as well. And I just want to encourage everybody to please think about others in your family, in your neighborhood who may be struggling at this time, and how you might be able to reach out to them. We know we have physical distance requirements, but that doesn't necessarily mean we need to be socially distant, and there are ways for us to reach out. So I look forward to working with all of you in the days ahead I know these are challenging days, but I'm confident we can overcome them if we're working together. Thank you all for joining us.